So I want to start, of course, with the victims of all of this, the families that are next to me. So we have Cynthia, we have Elizabeth Williams, and their mom, Shirley Murphy, was in an extended care facility in Toronto, Craigley. And on this side, we have Jeffrey Novo and Anna Leet, and their dad, Jose Novo, was in a Leisure World, which is now Sienna, nursing home in Brampton. So I'm going to start with what happened to Shirley. Shirley didn't last more than 6 months. So she had a condition, a skin condition, and she was also arthritic and had having more difficulty getting around. In a theme that we hear far too often, the supports that should have been available at home to Shirley, CCAC, was reduced, withdrawn, and so Shirley made the difficult decision to go into the nursing home, but only after Shirley and her family heard all kinds of representations about exactly what the nursing home was going to do for her. That was clearly not given over, and within a few weeks the family realized that they weren't going to be getting the care that they thought they would, but it was too late. She's in there. The apartment had been sold and they were really quite stuck. Shirley went through really quite horrific things. At one point, being unable to get to the washroom in time, she missed the toilet basically, and PSW told her that she had to clean up after herself. While trying to do that, she slipped, fell, broke her foot, ankle in 2 places, and was left on this filthy floor crying for 20 to 30 minutes with nobody responding to the emergency bell, which is supposed to be in all these washrooms. When she finally got someone to come and help her, taken to hospital, they found that the foot was fractured, and after that they never took her out of the bed. So she remained in the bed. Bed sores began, not surprisingly. They left a catheter in her for more than 2 months, got infected, and at the end of the day, again, a very common development, sepsis set in. It wasn't the nursing home that identified it. It was her son. Her son identified that she wasn't breathing right, that she had a temperature, and she needed to go to hospital. The nursing home finally called an ambulance, but advised the ambulance it was not urgent, so it took about 2 hours for the ambulance to get there. And she did not come out of hospital. She died within a day. So I'm going to move to the Novos, and then I'm going to ask both families to sort of comment on what they've been through. So the Novos, Jose, he had a stroke. He was a very young man. Actually, both people who passed away here were quite young. I think Shirley was 72, and Jose was 65. He'd had a stroke before going into the nursing home, and he'd been looked after by his family in a very dedicated way for a good 5 years. He needed help eating. He couldn't eat on his own because of his stroke, and he had a weakness in the throat muscles, as again quite typically happens with strokes. And he needed a special diet. The food needed to be pureed, and he needed to be fed. He needed to be fed slowly so that he could clear the food out of his mouth before the next spoonful. Again, this was a condition he came into the nursing home with. This was Tullamore in Brampton. Tullamore told the family they could and would deliver that care. Within weeks, it was clear they were not interested in spending the time to feed Jose. He was already starting to, within a month, he was back in hospital because he was dehydrated. He began to develop aspiration pneumonia, which is what happens when, you're not clearing that stuff out of your mouth and it's instead ending up in the lungs. And he lost weight. He ended up covered in bed sores of a condition you can't even think of in nightmares. And at the end, when the family asked the coroner if the coroner would photograph the wounds on their father, the coroner would not do it, and it required the family to actually go in at the end and take photos to indicate, the condition their dad had been in. And that's another theme that you'll hear over and over again, or we do. Families have tried to bring in police, Ministry of Health to do inspections. And they turn everywhere they can. They make phone calls. Nobody answers. And, this is not a condition that the families can wait to have assistance in. They need help for their family members right away, and they're not getting it. So before I turn it over to the two families, I do want to also, though, thank Franz Jalinas. She's here now, and I appreciate that she is. Franz has been quite the friend to individuals in nursing homes. She is well aware of the problems, and we've interacted with her office over the years over and over again. So thank you for assisting with getting this press conference today. I think it's an important issue, and appreciate that your attention to this. So I want to start, if you wouldn't mind, talking about a little bit about what happened with your mom and the effect on your family and why you're doing this.
Did you want to speak? Go ahead. Well, for me, it was traumatizing. It was, to watch this go down in 6 months was really horrific, and it was really horrific what we had to deal with and try to get help for her. We reached out to all kinds of, we reached out to the ministry, we reached out to anybody that we could to help us, and there was no help. So we had to suffer this and watch Mom turn into somebody that she wasn't, and it's been hard since she's passed, and the suffering that she had to suffer in that home, and we were powerless over that. And they took away her dignity, and they scrutinized her, they looked down on her,
And do you want us to explain a little bit about the interaction that your family had with the nurses there and what you
Oh, yes, we did. We had a lot of conversations about Mom's health and her condition, and they just seemed to look over at the doctor she had taking care of her on that floor. Only came in 3 times to see her in a matter of 6 months. She ended up in hospital from that broken from that PSW, asking her to clean up her own mess. And
I think, Elizabeth, you mentioned that every time you went in, the machine,
Yes, the machine was unplugged.
that was, what was it called again? Sorry.
Sleep apnea machine.
The sleep
Yes.
apnea machine.
So when my mom first went in the first couple of weeks, I noticed when I was going in to see her, she'd ask me to fill up her machine. And I used to wonder why. And I thought, aren't they supposed to do that? Right. So she was asking all of us to do it. So we would go to them and tell them about it. And Mom was afraid to ask them to fill it up because they didn't want to do it.
And when you mean afraid, had she asked before?
I don't know what it was. She really didn't tell me everything. I think she was afraid to tell me.
oh, she definitely was afraid. Oh,
Yeah,
yes.
she was.
Because she was afraid that what happened to her, her death, she knew that they were doing this to her. They knew. She knew. She had her mind, she had her faculties, and, she was scared, and I guess she didn't want to tell us too much, afraid the retaliation, and there was retaliation because she died and she was neglected. We were in, both our sisters, we have another sister and a brother. My brother was there as much as he could, and he seen it too, the neglect, bringing in cold food, making her wait an hour. She's a diabetic, leaving her into bed with
not being changed, like,
Not being-
she couldn't get out of bed after she broke her foot, so she'd be left in the bed, like, with, soiled, right?
Yes.
And she'd pull the emergency thing for them to come in, and it would
I was
be an
there
hour,
with her
an hour
one
and a
day.
half.
Yeah.
Yeah.
I was there with her one day, and I told her to ring the bell, and because she was telling us before that when she rings the bell, they don't come. So anyway, they didn't know I was there. There was nobody in the hallways, nobody at the nursing station. I told Mom to ring the bell, and it took them an hour to come in, and I had to go out for them to come in after that hour. So I just wanted to wait and see how long it would take them to come in to her. Because once you ring that bell, like, that's emergency, they need
Something. right.
attention, and they did not do that, and there was other, patients in the facility, that didn't, like, I'll be honest, he called them bitches, and they weren't nice, but that was in the beginning, and we didn't understand why he was saying that, and,
You're talking about another resident?
Yes,
another resident, yes.
Yeah.
So, and they put Mom on this pill, opiates, and Mom became different. She wasn't talking. She was afraid. She was hallucinating. She said she's seen cockroaches and cats and stuff
so
like
we
that.
knew.
So we were all like, we couldn't rest because, we put her in there to be looked after, not for her to hallucinate and see cockroaches, and she really believed she did. So I thought for sure maybe they do have cockroaches, so you can get this powdered stuff to put down. So, I'm thinking, oh my God, is she really, is it really happening? And,
I bet you think it was the medication.
oh, it
Oh,
definitely
yes.
was the medication.
Yeah.
Yeah, they did it so she wouldn't, because they knew she had her mind, and
But after she was taking the opiates for so long, you could see a difference in her. She was more quiet. She wasn't talking. She wasn't herself.
she wasn't phoning.
She wasn't phoning us.
And
as
yet you were
much.
mentioning that the medication she did need, the antibiotics,
They took her.
they took her off that.
They did.
Yes.
They did.
Without
and
consulting.
without consulting us or,
or
the doctor.
Her doctor for
Yeah.
her skin condition, Dr. Scheer.
And so tell me,
Sunnybrook?
tell everyone here, why are you doing this? Why are you coming forward like this?
Well, I'm coming forward for justice for my mom. I'm coming forward for all the other families out there that are probably going through what went through, and their loved ones probably are still in the home and it's going through it, and some probably died and didn't. They probably died and they couldn't get a voice or to get the help that they reached out for. So this is why we're here today. We're here for justice for our mom, to make sure
For
that this
everybody.
don't happen to any other families going forward, because it's been a long, hard road for us, to have to. When she went into home, they assured us that they were going to look after her, they were going to take her out, going to take her to pub night, all activities, but none of that happened. And especially when she told me she was scared, and when she yelled at her and told her to clean up her own soil, and that's when mom went downhill from after that, and she died within
A couple of months.
about 3 or 4 months. And that's why we're here today. We're here for a voice for other families and their loved ones that are in there, that are suffering the same thing, because it's happening as we're speaking right now, to the media and to everybody in this room. We just had to see our mother change and not look like the person she was when she first went in there. And yeah.
Thank you. Thank you very much.
Yeah.
So Jeffrey and Anna, I want you to talk a little bit about what happened. Now, I know, as I mentioned, you were looking after your dad at home. And so what happened, and what led you to bring him into the nursing home, and what happened after you did?
No, what led us is I had to start a job. I had to go to work financially. So we decided to put him in a nursing home, but it seemed like they were going to take very good care of him. And
When you say it seemed like that's what they told you when you went in for the tour?
yeah, they would take him out of his bed a lot. He would watch TV and go around the nursing home. In the beginning, yeah, but after, he didn't get out of bed ever.
And Jeffrey, what did you observe when you went in to see him?
When I went in there to see him, that he got skinny pretty quick. He didn't look right. And like, especially when we seen the sores, where I was disgusting. And like, what's happened, and then the feeding tubes keep getting clogged, keep getting sent to the hospital because it's clogged, and then there was a hole in the feeding tube one time. All stuff like that was just something wasn't right.
And when you say the sores that you observed, how many sores were you?
9 bed sores, stage 2, stage 3, and stage 4, right to the bone, 3 of them. And even his bone got infected, and it was just disgusting, pusty, just not right. It should never got that bad, especially after stage 2 should got controlled, not
And
worse.
Did you talk to anyone about the sores?
Yes, we did, and they said they're doing what they can. We're going to move him every 2 hours, I'm really sure it was. And I'm really sure they never barely moved him. Barely moved him, for sure.
And what about the assessments? Were they doing regular assessments?
They missed 70 assessments in 40 weeks.
And that was the investigation the ministry did?
Yes.
Okay. And you called the ministry?
Yes, we did, and a year before he passed away, but they didn't come in till like at least probably 3-4 months after he passed away.
And you called more than once?
Called tons times, 50 times, tons.
And what motivated you to go and take the photos that you ended up taking?
Because I knew there was something wrong, and like I heard it from the doctors from the hospital, like this is not right, so something was wrong. I knew it. So we went in and took pictures.
And he was always in pain.
And when you say he was always in pain, Anna, what do you mean?
You can just tell by his face, and he was just suffering. He had very expressive eyes. He didn't want to be there because he couldn't talk. But it was horrible.
So, this is hard for anyone to take, but it's something else again for me to discuss it secondhand versus what these people went through. The extended care class action was actually also launched initially regarding a case in Ottawa in an extended care home there where a woman, her daughter noticed that, actually the hospital figured out there were maggots in the resident's wound. And that is apparently not the only time it's happened. Apparently there's been another extended care case, I believe possibly in the Ottawa area, that's had a similar problem where maggots have been found in the wound. And I have to say that I would suggest the vast majority of Canadians would not expect that in a Canadian nursing home. That is certainly not the level of care when you entrust a member of your family that is the expectation that you're going to end up with wounds infected with maggots, wounds not treated at all, as we saw with Mr. Novo's case. Bed sores are, by the way, a symptom not just of not moving. They're a symptom of nutritional and dehydration issues. So if you're not getting enough to eat and you're not getting enough to drink, the cells of your body literally flatten out. So the cells over top of bone, as in the hip areas and the sacrum at the back, thin out. And so that's where you get the injuries happening. Nursing homes know this, or should know this. They should know that bed sores are a key problem in this demographic. There's a lot of ways to deal with it. There's wound care specialists that should be coming in. That is unacceptable. It's simply unacceptable. So, do you have any questions for my clients here, and before we move to the next part of this press conference?
Question for you. We've been hearing about these issues for years.
Yes.
Can you talk about how widespread this is? Is it getting better? Is it getting worse?
I don't think it's getting better. I can't say if it's getting worse. I know that our office and the offices of our colleagues who are working with us on this are inundated daily with these calls. One of the motivations for coming forward with these class actions was the sheer number of times we heard the same stories. Nothing that the Novos have described or Shirley Murphy's family has described is new. And as you've said, what bothers me as well is that the reporters have for years done these exposés. I want to know, for example, if you look at any one of the nursing homes that's involved with the 3 cases that are being featured here, you will see a slew of Ministry of Health findings. So it's great. We now have transparency in that you can go online and you can see one after the other of these findings. And then what? And then what? Do we just catalog that these abuses continue to happen and they're now on websites that we can all access? What happens to these people? And of course, family after family after family comes forward after someone has died generally, and the next family takes their place. So we're hoping that with the coalition that we'll talk about later, that we're going to make a difference in that, because as you've said, this is not new. It is, I mean, the stories go back in all the major newspapers, TV, and radio for decades. And it must stop. I don't think this is appropriate for us to treat the vulnerable elderly in this fashion.
In your research so far, what do you believe is at the root of the problem?
I think, unfortunately, these are homes that the focus is making money. It is not delivering care. And as long as they're allowed to do this, as long as the ministries of the different provinces simply catalog the abuses versus shut them down, penalize them, fine them in some way, it's just, so what? So what? They get a finding. I mean, it doesn't impact on their day-to-day functioning. So I think that, one of the things you'll see in the media release is my reference to the fact that we've pulled up information about how much money the CEOs of these corporations are making. Huge amounts of money. So it's not a resource issue. There's money there to be made. The problem is it's going right to the top. And I have no issue with someone making a healthy paycheck. But if our expectation as a society is we're putting in our vulnerable moms and dads into these homes, then before that guy gets to pay himself a bonus, Jose Novo needed to have been looked after, and he shouldn't have gotten to that condition. Why would anyone running that home get a bonus? This is not a scenario that requires a bonus. So that's my 2 cents worth.
So what do you think is needed from the government? And I would also love to hear from the 2 families, with 5 weeks to go before the election, what are you looking for that you think the government can do to change this, to make a difference?
Look, the government, and I'm going to let the families come say a few words too, but here's my perspective. The government, any of these governments, and don't forget these are class actions across Canada, every single government has enormous muscle in this scenario. The nursing homes get money from the government to run these things. It's great for the nursing homes because it's a guaranteed amount of money. They never have to worry about market trends or anything. This is guaranteed money. There's huge waiting lists, so whenever one person passes away, there's 150 people waiting for that bed. So, but the government has all the advantage in leverage here. They can say, we're not going to let people come into your home unless we get this, and this. The government has a very large book of standards that they require these nursing homes to meet, at least in Ontario. I would expect it's the same in all the provinces. But if it's not met, it's not enough to simply make a piece of paper that says the standard wasn't met. We need to take it. Certainly more inspections. When you hear from the Novos that 1 year before their dad passed away, they began calling the ministry for help, and no inspection was done for several months after his demise. How in the name of heaven are you going to do an inspection about what happened to Jose Novo when he is no longer there for someone to come in and see what his condition is? So definitely more inspections. But certainly, as I said, we've got to take it beyond simply cataloging the misery, and we need to start talking about fines. We need to start shutting down some of the homes, halting admission until some of these issues are dealt with.
Would it be better off if more money went to nonprofit places?
I think that's correct. I have to say again, if the focus isn't all about making money, then the funds that are coming into nonprofit places end up being used for what we would expect them to be used for, which is care. And I have to say, the calls do not come in very regularly from the nonprofits. So we do have problems. I've heard, people call. But it's not the avalanche that we get from the profit-run places.
You think it's more about money? Can we talk
I
about
think
that?
so.
And why is
What do you guys think?
Most definitely.
For sure. It's about the money.
Oh,
Yes.
yes. Oh,
sure.
for sure.
Yeah.
Yes.
They're just cutting costs?
Yeah,
Guaranteed.
because, I remember when my mom first, she got the call to go into Craig Lee. And as soon as they said to me, and make sure you brings in $1,000 check. Yeah. So then I thought, okay, it's about money, right away,
Yeah, it's about money, I think.
Yeah.
And again, money may fix this, because if our courts ultimately determine that this kind of systemic negligence is not appropriate, and in some way give us a good finding here, if money is their prime objective and they will be penalized on a monetary basis, that will be an incentive to do things differently. Any other questions for the families?
Can I get your names?
Yeah. Cynthia Devereaux.
Elizabeth Williams?
Jeffrey Novo.
Anna Leet.
I'm Amani Oatley.